Dr. Dunleavy, what is IBD and how is it different from something like irritable bowel syndrome or IBS?
I love that we're going back to basics. Talking about inflammatory bowel disease. It is a chronic condition where the immune system mistakenly attacks parts of the digestive tract. So that means inflammation, and over time, that inflammation can lead to some complications or damage. When we talk about inflammatory bowel disease or IBD, we typically refer to our two main categories of Crohn's disease or ulcerative colitis. Irritable bowel syndrome or IBS, which sounds too alike to IBD, in my opinion, is a very different condition. It's what we refer to now as a disorder of the gut-brain interaction. So what this means is that the way that the gut and the brain communicate is a little bit dysfunctional. And so how you feel your gut, how things move, can cause symptoms like constipation, diarrhea, bloating. But the main difference is that there is no inflammation in patients who have irritable bowel syndrome, whereas inflammation is the mainstay in IBD. I will say that understanding this difference is really important because misdiagnosis in either direction can cause havoc on a patient's medical journey, but also on the treatments they may receive. So for instance, if someone is misdiagnosed with IBD when they actually have something else, so a mimicker of disease like an infection, celiac disease, or even something like colon cancer, that can actually delay their further treatment for their real disease, and sometimes even starting immunosuppressive medications can worsen their course. While on the other hand, if a patient is told that they have irritable bowel syndrome, but in reality they have inflammatory bowel disease, they may go untreated for some time. So that inflammation can smolder and unfortunately can develop complications, things like strictures or fistulas in Crohn's disease, or even things like progressive inflammation, leading to make it harder for us to treat our patients when they finally get to our office. And so really, it's important for us to get the diagnosis correct from the start. And that's why I encourage patients to really work on that aspect of their journey first. So when I see a patient, that's always the first thing I do is confirm that we're all talking about the same thing. And that from that index colonoscopy, which is what we refer to as your very first scope where there was evidence of inflammation or not, we like to be sure that the pathology and the endoscopy, meaning what we see with our eyes, matches the clinical picture.